because you're male, you have testosterone. With prostate cancer, that may be it. It's perfectly normal. Something happens, and it gets stuck on stupid, and then it does all this stuff that we're talking about. So I felt like I just wanted to kind of put that in there, so it doesn't matter what kind of cancer you're talking about. All of them, every last one of them starts with a perfectly normal cell. Okay? So tonight, we're going to talk about two different kinds of cancer, and we're going to start off with kidney cancer or renal cell carcinoma is the big words that they use for it. The thing about, I love these drawings, and I always want to provide them because I want you to know where those things are located. Now, guys, most guys know, like when somebody hit you, kidney punch. You know what it is? That's it, right there. Man, if somebody hit you right there with a fist, you're going down. That hurts. That's where your kidneys are about as big as your fist. And they sit right here, just below your rib cage, right there in your back. That's where your kidneys are. So what the kidneys do when they're acting normally is that they filter the blood. So anything that's in your blood and every bit of blood that you have in your body goes to the kidney. It goes to the kidney. What the kidney does is a big old filter. It filters out stuff. So if you're taking any kind of medicine, it goes to the kidney. If you're drinking alcohol, it goes to the kidneys. If you're smoking and it gets in your bloodstream, it goes to the kidneys. So the kidneys work really, really hard. So it serves as a filter for the blood. It removes excess water and waste. Potassium, glucose, and all that stuff. When you go to the doctor, they draw those lab work, and sometimes they get a urine sample. They want to see, especially if you're a diabetic, they want to see if you got glucose in there. Because if you're spilling glucose in your urine, that means it's too high in your bloodstream. Your kidneys are trying to help you. So that's how the kidneys work. They filter everything. They not only filter everything, they also provide two other functions. They release hormones. Kidneys make hormones. Kidneys make a hormone. One of them helps control blood pressure. It's called resin. Something called resin. It helps control blood pressure. So when your blood pressure is high over a long period of time, your kidneys are working overtime, trying to, first of all, the pressure of having your blood pressure up so long, that's making them work high. And then it's trying to produce a lot of this other hormone, this resin, trying to bring it down, so you're working overtime with your kidneys. Then the other thing is that it helps with the production of red blood cells. So if you know anybody that's on dialysis and their kidneys don't work, they're chronically anemic because they don't have the ability. Well, this is one of the things. There's a lot of different ways that you make red blood cells, but the kidneys is just one piece of the pie. So it works as a filter and also produces two hormones. That's when it's normally functioning. And if you look at that picture, when you look at the kidneys, those two fist-sized things, they have those tubes that run down from them. So kidneys, they're filtering, they're pulling stuff out, and then it removes it in the form of urine. So they get water and waste, and it goes down in those tubes. It goes to your bladder and eventually out of your body. That's the way it works. That's a normal functioning in kidneys. But when you look at kidney cancer in itself, kidney cancer, when you look at overall the total number of cancers that we see in the United States, it's a small number. It's not that many people that you hear about that have kidney cancer, about 3 to 5%. But when you look at it, if I'm that one, I don't care what this number says, if I'm that one, it's a problem. So you see it more common in men, and actually you see it more often in African American men. And you see in some other nationalities. And also kidney cancer can cause over 15,000 deaths in a year. It occurs most often between the ages of 44 and 74. So now let's talk about these risk factors. The stuff, remember I said that cell, perfectly normal, gets stuck on stupid. And then there's some stuff that we can change, some stuff that we can do. But if we don't do those things, that increases the risk of that cell getting stuck on stupid and continuing on to forming cancer. So some of those risk factors for kidney cancer is as we age. Kidneys been working a long time for some of us. They've been working a long time, they've been working hard. So just as we age, because it just gets tired, That is one of the things. Smoking. You know, the only thing, I think I may have said this before, the only good thing that comes out of smoking is the people that got stock in the companies that making money. But from a health perspective, there is absolutely nothing that's beneficial about smoking, whether you're smoking the cigarettes or whether or not you're chewing tobacco or snuff or any of those things. There's nothing good about it. Excess weight, high blood pressure, and then having a family history of someone in your family that had kidney cancer. With, and again, it happens more often in men, and again, more often in African American men. And y'all, this slide keeps coming up. This modifiable stuff that can change, stuff that can't change. The disparity, it keeps coming up. Remember I said that first night, you can take the same slide and use it for every kind of cancer. Because there's some stuff you can change, there's some stuff you can't change. And then there's some stuff based on where you're born, live, work, play, and pray that can actually impact whether or not that's going to increase your risk. So the stuff that you want to focus on, I already talked about those risk factors. We can do something about stop smoking. We can do something about that. Is it easy? For a lot of people, it's not. We can do something about excessive body weight. And remember I said early on when I first started talking, it's not so much the number on the scale, it's about what you're doing and what you got. Are you moving? Are you active? I know the doctors love that BMI number, and that is not my friend. The BMI is not my friend, but it's more about no matter what your body size is, how active are you? That's more of a factor than any of it. The stuff, again, you can't change your age, you cannot change your race, you cannot change your family history. And there are a few, and it's a rare thing, there are some kidney cancers that are some things that are passed on through the family. So that's what we're looking at when you talk about risk factors. So when you look again at kidney cancer, what are the causes? You know, some stuff we can directly put a finger on it and say this is what causes this kind of cancer. With kidney cancer, we absolutely don't know. They don't know what causes kidney cancer, not 100%. So, but we do know that there's some things that will again increase your risk of developing kidney cancer. So one of the things that they found is that if you have someone that has a workplace exposure to chemicals, nickel, and all those kind of things in those plants, farmers that were doing pesticides back in the day before we knew that you should not get that stuff on your skin. Y'all remember I said before, we used to spray our houses with that stuff. I remember I used to go stay with my grandmother's house in the summertime, and they would put cotton poison in the house to get rid of bugs and mosquitoes. So now we know, and you know, when I think about that, and as I've gotten older, I only stay with my grandmother during the summer, but looking back, my grandmother, my grandfather, and all three of the younger children that stayed in the house, that's when they were doing crop dusting. The cranes would come and spray, and it would spray while they were in the field. Every last one of them had some kind of cancer. Every last one of them. My mom, by the time they started doing crop dusting, was older and she had left home. So my mom and her older brother, the two older children, were not raised in the area when they were doing crop dusting, where the plane was just spraying stuff. But every last, my grandmother, my grandfather, and my mom's two younger brother and her younger sister all died from some kind of cancer. So think about it. Think about what's going on, what's happened in the past. Now, there are some genetic changes with kidney cancer. Some of them, again, as I said in another slide, come from family members. It may be something that runs in the family that's inherited. But then some of them, when I said that cell gets stuck on stupid, that's your DNA, that's where your cells come from. That's an acquired. You weren't born with it, but something happened that made that cell get stuck on stupid, so that's acquired. You weren't born with that. So as for a prevention kind of thing, there's honestly nothing that we know that can absolutely prevent you from getting kidney cancer. There are a couple of cancers that we can prevent. Remember, we said that you can prevent colorectal cancer if you get colonoscopy and get screened. You can prevent cervical cancer. You can stop it from ever happening if happen if you get those other things done to keep it from turning to, you can prevent it. But with kidney cancer, there's no absolute way that you can absolutely prevent it. The whole point is that you want to reduce those risk factors that you can change. So, it doesn't happen that often. When it does happen, though, you really have to pay attention. So the other problem with kidney cancer is kind of like those other cancers that happen on the inside of your body, the internal organs. Early on, there are no symptoms. There are no symptoms with early disease. And typically, if someone has a kidney cancer and they found it early because they were checking for something else. They were coming in and they had to get a CT because they were checking for something else. Oh, I see a spot on your kidney. I said that's God's grace when that happened. That's the blessing in there. You fail and I got to get an x-ray and oh, this looks, that's God. That's what I always did. Ain't no accident. That's God. So typically, most people, if they find it early, that's how they do it. But there are some symptoms later when it kind of gets to be a more progressive disease or it actually forms a tumor. The one thing is urine and blood in your urine. If you don't remember anything that I've said over these, however many times I've been out to speak with you, unless you are a female and are actively having a menstrual cycle, blood should not be coming from anywhere in your body other than that. And if you are postmenopausal, you should not start having a cycle again. You should not. It is not okay for blood to come out of your body unless you are, again, a female that is still having a menstrual cycle. But beyond that, if you're peeing and you see that your urine is tinged pink or red, that's not normal. You need to get that checked. The other thing about kidney cancer, it's not bloody all the time. It'll be bloody. You see it one time, you're like, oh. And then you go, and then the next day it's clear, but it keeps coming back. It'll pop up every now and then, so it's kind of inconsistent. It's here and then it's gone, but it consistently keeps coming back. But if you see it at all, report it and get it checked. You should not see blood or pink or, your urine is automatically orange or yellow, but when you start seeing it leaning toward pink, you might want to go get that checked. The other thing is unexplained low back pain. So if you didn't hurt yourself, if you don't have a bad back and all of a sudden it starts to hurt, and that's honestly why my husband's not here tonight. He was out there in the yard doing some stuff he had, so he started having some low back pain. So he said, what do you think I need to do? What did Jessica tell him? Go to the doctor. Go to the doctor. Well, what do you think it is? I don't know what it is. Go to the doctor. Go to the doctor. So he's at home with some steroids and some anti-inflammatories for his back because he's got a disc problem. But don't ignore it. Just because you have a low back pain doesn't mean it's cancer. But if something is going on, go get checked. Go get checked. So, or you can have a mass in your side or your lower back. And the other thing is fatigue, always tired. Always tired, and there's no reason for it. Now, if you've been up all day long, you got up at 6 o'clock, you went to work, you cook, you cleaning, you doing all, or you chasing your grandbaby, your sweet grandbaby, you got a reason to be tired. But if you're tired, no matter what you do, no matter even if you sit down, or you lay down, or you get up out of bed in the morning tired, that's a different thing. Doesn't mean it's necessarily cancer, but it does need to be something that's checked out. Loss of appetite, and then you have unexplained weight loss. I wouldn't try it. Everybody's trying to lose weight nowadays. Yeah, I want to lose it, but I ain't really doing nothing to do it. So everybody taking these shots and these pills and things. If you have unexplained weight loss, you're eating the way you think you should eat, but you're still losing weight. That's the kind of thing that we're looking at. So those are the signs and symptoms. I'm trying to keep myself straight and I don't miss stuff. Like Mr. Bohr got this staple in some kind of way. This is Mr. Bohr, so y'all said she did a good job. So if someone has a kidney cancer, how is it diagnosed? How do you find it? First of all, they have some kind of symptom, or they find it kind of accidentally because they were looking for something else. The first thing is that once you have those symptoms or you get some type of scan, I will say this, people will say this, well, I had an x-ray. An X-ray does not pick up tumors very well. Just a regular plain old X-ray does not pick up tumors very well at all. So we're talking about something more along the lines of a CT scan or an ultrasound. Ultrasound, like women, when you're pregnant, you get ultrasound. You can get ultrasound of your abdominal cavity. You can get an ultrasound of your kidneys. And you can see if something looks different on it, something different about the shape of it. So CTs, MRIs, ultrasounds, some type of diagnostic scan, and let's see what's going on here. The other thing about it is with cancer, because I think I said the first night is that cancer can start in one place, but it can move around. It can go any place. Just because you find cancer in your lungs, it means lung cancer. It could be something that's spread from your breast. It could be something that's spread from your colon. So it could be a lymphoma. So it could be a lot of different things. You've got to get a piece of it. If you see something with kidneys, if you see something on the kidneys, they see a mass, they see a growth or whatever it is, they got to get a piece of it, and that's a biopsy. Most of the time, the way they will do those biopsies while they're doing the CT scan, they have what they call needle directed. They got them on the table with the CT scan and looking at it. They'll numb up the skin real good and put a little needle in there and get a piece of it. So you don't have to have a major surgery. You can get up and go home immediately after the biopsy is done. So that's generally how they do those biopsies. The other thing is that not only will they get the scans and get a piece of it, they're going to check lab work. They're going to check to see how well your kidneys are functioning. There's just some basic lab work that will tell us how well they're functioning. And when you get that, if you have one kidney that's not working just right, those lab work values are going to be a little off. They're going to be off. They're going to look at that. They're going to look at your blood count. Remember I said anemia or that fatigue? If your hemoglobin or your red cell count is low, they're going to be like, okay, let's walk this down and see what's causing this. And then they will also get a urine sample. They'll get a urine sample. So what they're looking for, there is a normal level of certain types of proteins that should be in your urine, but if they're elevated, that doesn't mean you absolutely have kidney cancer, but it does mean we need to investigate this further. And then there's another urine sample that they get. It's called urine cytology. And what urine cytology is, the way from our standpoint, you can still get the sample in a cup, but they take that sample and they put it under a microscope, and they're looking for cancer or tumor cells in the urine. Because if you have it in your kidneys, remember the kidney's still working, it's still flushing, it's still filtering everything out. So some of those cells, if there's a tumor there, some of those cells could get in the urine too. So that's why they check that. So those are how you get it diagnosed. Once it is diagnosed, then you know what you have. You've identified that it's kidney cancer. Then you got to figure out how we're going to treat it. How are we going to treat it? Treatment really depends on how much disease you have or what the stage is. You got a little bit or you got a lot. So early stages, there's general stages of stage 1, 2, 3, and 4. So early diagnosis, and this is one cancer. If you find it early, there's surgery. What they would do is just take the whole kidney out. You know, this is one thing, God gave us a spare part. We got 2 of them. And you can live with one kidney famous as well. You can do fine with one kidney. So if they find it in an early stage, they will just take that kidney out. And for the most part, if they find it early, you don't have to give chemo, you don't have to give radiation, you don't have to give anything else other than going to surgery and getting that kidney out. I have a friend of mine that's a nurse, and I know it's been at least 20, 25 years ago, and she had kidney cancer, and they took one of her kidneys out. She's still fine. Has never had a reoccurrence. It never came back. So that's, if you have to go that route, that's where you want to be. You don't want it at all if you have an option, but that's one of the things that you would do. Now, if you don't find it early, or if it's not identified early in some of the later stages, there are things that you can actually do. This is usually a combination of things. Usually it's going to be some type of chemotherapy, and then there's biotherapy, which is still drug therapy. That's that new stuff that they got out there where chemotherapy, I think I said before, chemotherapy is a stupid drug. They don't know a good cell from a bad cell. You put chemotherapy in a body, it's just going to kill anything that's growing fast. That's why you have all those side effects of chemo. People are nauseated, the hair is coming out, and stomach feeling bad and all that kind of stuff. That's because chemo don't know a good cell from a bad cell. They're just killing anything that grows fast. But these new drugs, this biotherapy stuff, it's more specific. It's going to target one thing, one cell, one type of cancer. So they actually have those drugs that are specific for kidney cancer. So a lot of times you have the option, or patients have the option of getting combination, either chemotherapy plus biotherapy, or they can get the biotherapy, that targeted thing is only going to go to their kidney cancer. It's only going to affect that. So you don't have nausea, you don't have hair coming out, you don't have blood count being low, you don't have folks being tired and feeling bad. You don't see any of that with these new drugs. They have the other side effects, but not the classic stuff that you think about. Now, there is one other treatment that they give for kidney cancer. I talked about before they just take the whole kidney out. There's something called ablation. What ablation is that they put the patient on a table, do a CT scan. Remember I said they put a needle in it to get a biopsy? With ablation, they put a needle in it, and then they either put something super, super cold or something super, super hot and kill it. They ablate it, they burn it, and kill it. So that is one of the procedures. That's something that they use called ablation. It can either be with heat or it can be with cold. So it just sticks a needle in it and lets it just fry it. Just fry it up or freeze it until once it's frozen, those cells do not regenerate and they don't come alive again. Once it's burned or once it's frozen, it's just dead, it's just sitting there. So those are our treatments that are available for kidney cancer. So now that we know that and we got that, so with kidney cancer again, remember this is the urinary tract system. The GI, this is urinary tract system. So it starts in the kidneys. Remember that picture, it had tubes running from the kidney, and those tubes run down into the bladder, which is basically a balloon. Your bladder is a balloon. A balloon. And when that water comes out of the kidneys, it goes into the bladder, and the bladder's full. Y'all know what that feels like when it's super full. And you gotta go. When you gotta go, you just gotta go. That's what that is. It'll hold some, it'll hold a lot, depending on how much you practice holding your urine, which is not a good thing. And I will say nurses are notorious that will have to go to the bathroom. We'll wait 2 or 3 hours before we go to the bathroom. Because we're busy. I got a patient that put the light on, I can't go to the bathroom. So I had to go to the bathroom an hour ago and somebody called me and I went and took care of it and then you forget. And by the time you go in there, Lord help you, running hard. So that's where your bladder is. And again, kidneys got those tubes that are called urethra, and they both are tubes on each side. One comes from each kidney, and both of those tubes go into the bladder where the urine is. Okay. Now, when you talk about bladder cancer, there are a lot of different names. I didn't put that in here. There are carcinoma and this and that and all these different kind of names. It just depends on what part of the bladder they find the cancer as to what name they call it. So it can be, in this picture, it could be connective tissue, it could be transdermal epithelial, all that stuff. For me, okay, that's good to know. For somebody to know. Well, for my purposes, I just want to know if I got it. That's it. So there are different names for the bladder cancer depending on where they find it in the bladder. If it's on the inside bladder, if it's in the wall or the muscle, or has it eaten all the way through to the outside. Okay. So the risk factors for bladder cancer. Tobacco is up at the top again. And this is specifically smoking cigarettes. Smoking cigarettes will increase your risk factor of getting bladder cancer. Also, if you have a family history of bladder cancer, Doesn't mean that you inherited it from a child, but if your life, remember, one of the things I talked about early on is that when you talk about social determinants of health, if you were raised in a certain way and you all were raised the same way, or you were exposed to the same things and it kind of runs in your family, it's not something that you were born with, but because of the way you were raised, because of the way you were exposed to things, you can see it going down a family line. There are some genetic changes that can happen. Looks almost just like kidney cancer, doesn't it? Almost just like it. Workplace exposure, environmental exposure. Again, those same things, some stuff you can change, some stuff you can't change, and some of it is based on our social determinants of health. Same thing. So those are what we're dealing with when you talk about bladder cancer. So when you look at the symptoms of bladder cancer, again, blood in the urine, that's going to be the first one. Blood in the urine, again, there should never be a time that you are just going to watch and wait if you see that your urine is turning pink, or it's a red tinge or blood tinge or little spots of blood in your urine. That's not a wait and see. That's make an appointment to get somebody to check it for you. The other thing is that if you, and this is something I have to kind of say with caution, because as we age, and particularly with men, a lot of times you have what they call this incomplete emptying, where you go to the bathroom, you start to pee, and a little bit comes out, and then it stops. And then you wait a little while longer, a little more comes out, and it stops. And a little more comes out. So women can have that issue too, but you tend to see it more often in men, because men with their prostates doesn't necessarily have to be cancer. Prostate, as men get older, can enlarge, and it does cause that flow issue, that hesitancy in the flow. So it feels like you gotta wait a while and strain before it'll come out. And so you end up either not emptying at all, or you have to go a lot, because by the time you sit out 10 or 15 minutes, and, oh, I gotta go again. That kind of thing is what we have going on. The pain, burning during urination. Now, that's a classic symptom of having a urinary tract infection. So if you're burning and stinging while you're peeing, whether you're a man or a woman, go to the doctor. I tell you, the worst I've felt in a lot, and I've had some illnesses in my life, the worst I felt, my husband came, I was laying on the couch, couldn't get my head up. I had a terrible UTI. I was about to go to the hospital with a UTI. The other thing, our senior, I call them our seasoned saints, if they get a UTI and they're seniors, it messes them completely up. They get disoriented, their blood pressure drops. And so when you see a senior, especially with nursing home residents, where all of a sudden their behavior just totally changes. They either become really loud, belligerent, they try to fight you, they get confused, and this is a sweet little person that never did that, never said, excuse me, Pastor, never said a curse word, but they be dropping some bombs. And it's because they have a UTI. So urinary tract infections can be very serious. So you want to check, first of all, check to see if it's a UTI. It may be, and it'll go away. But if it's not a UTI and you're still having no symptoms, then that's another step. So every symptom does not mean cancer. Every symptom does mean you need to let somebody check it. So, and that's one thing, y'all would leave here paranoid, because everything I said is stuff we do every day. It's like, Lord, I must be walking around with, no, you just be walking around aware. Don't be scared. Don't be scared, but be aware. I know, and the way I'm talking is like, my Lord, I got cancer already. That's not what we're talking about here, but I want you to think about what's going on with your body. And when something is not right, go get it checked. 9 times out of 10, it is not going to be cancer. We're going to pray to the Lord and stay at 9 out of 10. But that one person, it may be a cancer. But the thing is, don't wait and let it fester. Go get checked. I almost had to kick my husband out of the house. He'd be like, well, what am I going to do? I need to wait till next week? No. Say, no, so y'all meet him again. Yeah. Well, when can I do? When I need to go? Tomorrow. I wanted him to go yesterday. He said, but I called and they didn't have an appointment open for me. I said, well, so when you going? I said, because we go and sit in the office till they get an opening. I'm that kind of wife. No, we're not going to sit on this. So you need to be like that for yourself too. Be your own advocate. Go when there's something that's not right. 9 times out of 10, it will not be cancer, but you want to take care of yourself. So those are some of the symptoms of bladder cancer. Again, with these cancers, some of these cancers, there's no screening for bladder cancer. There's nothing different. There's no screening for it. You know, we can screen for colon, we can screen for breast and prostate and cervical cancer. We can screen for those things. There is no screening for bladder cancer. There is no screening for kidney cancer. There is no screening. You just follow the symptoms. And the symptoms is what would drive you. So there's nothing out there that says we're going to screen you to see if you got bladder cancer. So what the screening or the investigation happens with the symptoms. Or I'm saying it's a God thing, if just by happenstance or because you got to get a scan for something else. They saw something and said, let's look again. Let's look again. So attempt, because most of the symptoms that are talked about are not going to be bladder cancer, so you're going to attempt other avenues. Treat the infection if it's burning and stinging, and they draw a urine sample. They can send it to the lab to see whether or not there's any bacteria in there, like some antibiotics. But if you got a bladder infection that's been 4 weeks and it never cleared up, somebody needs to be looking a little deeper. Somebody needs to be looking a little deeper. For men with that hesitancy and not completely entering, emptying it may be prostate. Again, it doesn't mean it's prostate cancer. It could just be an enlarged prostate. And men, if you are alive and breathing and the Lord leads you here, your prostate is going to get enlarged to some degree. So have it checked. They call it benign prostate hypertrophy. Doesn't have anything to do with the cancer. It's just a natural hormone thing that happens. So how do you diagnose? How do you diagnose bladder cancer? There is a test, it's called a cystoscope. What a cystoscope is y'all seen a Foley catheter where they put the tube in and they go in and drain the urine out? A cystoscope is kind of like that, but it's a little bit larger. They actually put the scope or this tube inside either a man or a woman and put it into your bladder, and it has a camera on it. And they're looking kind of like getting a colonoscopy, but the tube is much smaller, thank you, Lord. It's much smaller, but they actually can look around inside your bladder to see if something is going on. They can look around, similar to what you do with a colonoscopy, they can actually do a biopsy with this cystoscope. So they actually put this scope in and look around and can get a sample. They can also, the urine cytology that I talked about back when I talked about the kidney, they can take a urine sample and put it under a microscope to see if there are any tumor cells on there. And of course, the biopsy. Yes, ma'am.
Well, if you go to a doctor and you want them to send you to a kidney doctor or a bladder?
They're the same. They're the same. But why would you want them to send you there?
Because you have problems with your bladder.
Okay, if you know that you have problems with your bladder, yes, you do. And the doctor is a urologist.
Okay.
Urology are the person that has all things to do with the urinary tract system, whether it's your kidneys, your urethra, those tubes that lead from your bladder, from your kidney down to their urologists.
Okay.
Urologists. And they are, for men, just kind of FYI, urologists are a lot of the folks that help with that hesitancy or incomplete emptying of your bladder too with enlarged prostate. A lot of urologists are the ones that manage prostate problems. So urologists. Women, if you have problems with emptying or you keep a lot of bladder infections and things like that, they can monitor that. So if you have persistent problems with your bladder that don't get better, then you would see a urologist. For the most part, if you just have a normal, I have a bladder infection every now and then, your general doctor can handle that.
If you don't have a bladder, say you feel like your bladder doesn't come down or what, can it?
Okay, when you have prolapse, that's prolapse. So when that, you're going going to start that with your GYN. That's going to start with them because there are a lot of structure between your uterus and your bladder sitting right there. It can fall down into your pelvic cavity. And that's because women that would carry babies and those muscles get weak and where they're not tight anymore, so the structures that are in there can drop down.
Is that cancer?
No, ma'am. That is not cancer. That's just weak muscles.
Oh. Okay, thank you.
Just weak muscles. Just weak muscles. Bladder's fine. It's just the muscles are not tight enough to hold it. No, it's not. It's not. And the other thing is like, and y'all, you know, I'll go there. You know, for women, when we get a little older, don't sneeze too hard. Don't sneeze, because a little bit, they got a commercial now, oh, I breathe a little bit. You know, that's because of the muscles. The muscles get weaker. Doesn't mean you have any kind of cancer. You do need to follow up with your doctor and let them know about it. But for the most part, there are just natural aging things that can happen. There are some exercises and things that you can do, but that's a whole nother talk. But it's not cancer. I love it when you talk, when y'all ask questions, because that means hopefully it will be helping. You know, because this bladder and kidney cancer is a rare thing, but everyday living and everyday symptoms that you're having to distinguish in your mind, well, do I need to be worried about cancer or not? No, you worry about your health and making sure you're being followed by the right person. For men, they will more likely get to a urologist before a female will. For a female with those kind of problems, most of the time your GYN doctor is going to be the one that manages that. If it gets to be more than what he or she as a GYN can do, then they will send you to a urologist as well. Okay. I love it. Makes my day. All right, so with bladder cancer, again, just like any other cancer, how well you're going to do, that's what prognosis is going to be. How big a chance do we have of actually curing this cancer or getting rid of it? It depends on how much it is. So it depends on the stage. How much cancer is present. Remember I said stage 1, 2, 3, and 4. Depending on how much it is, how much is spread, did it go through from go beyond where it started. So the other thing that's going to determine how well you do is what is your baseline function. I used to work with this doctor. He said some patients, when they come in, they look like a horse that's been rode hard and put up wet. Y'all know exactly what I'm talking about, though. Y'all know exactly what I'm talking about. There's some folks, God bless them, they look like they had a hard life, intentionally or unintentionally. There's just some of us that don't necessarily age as well. And you look at them, you think, this person, you look at some, you know, God bless them. I got some classmates, I look at them, I'm thinking, Lord, they look like they're 80. That's what we're talking about, age and general health of the individual diagnosed. Because if you're coming into a cancer diagnosis and you got a bad heart, you already got bad lungs, you already got diabetes, you got high blood pressure that's not controlled, for any kind of cancer, that's going to make it more difficult to treat you. It's just going to make it more difficult to treat you. So that's why, while I'm talking about cancer, I'm hoping that you all are hearing me say that the baseline health, how you manage whatever your issues are, we all got issues. Whether it's high blood pressure, diabetes, you know, if it's been some kind of cancer, if it's whatever it may be, whatever your issue is, you manage it, don't let it manage you. Had a conversation with someone that said, had a family member that just decided they were going to stop taking their blood pressure medicine. Had a stroke and died. That was a narrative that he could have done better. So that is our responsibility. It's not the doctor's responsibility to manage these things. So when we talk about those modifiable things, when it comes to cancer, that is something we have control over. We can change the narrative. You know, we serve an omnipotent God that carries us and covers us and protects us. But all these kind of cancers that I've talked about, so far, from speak personally, so far he's not brought it to my house, to this house when I'm talking about a house. It's been in my family. but it's not been in this particular house. That's nothing but God's grace. There's nothing that I was so good at that I did everything so right. Like, y'all can look at me, I'm a little thick. You know. So I still got stuff to work on just like everybody else. So no one is perfect, but we got to start somewhere. So when you talk about bladder cancer, again, the treatment is dependent upon the stage. It's the exact same thing that I talked about for kidney cancer, surgery, radiation, chemo, target therapy. But there's something else. You remember when I talked about that cystoscope where they actually look in and get the biopsy? There's also a treatment for bladder cancer where they actually put in something that looks like a Foley catheter, and then they run chemotherapy directly into the bladder. Tie that thing off or clamp it off and let the chemo stay in the bladder for a while. Just let it sit in there and they roll you from side to side. So the chemotherapy is washing or coating the inside of your bladder. That's one of the treatments for bladder cancer. So they put it directly into the bladder and let it sit there or stay. So they clamp the tube or the Foley off, they clamp it off. Let it sit there for a while. You have to again roll from side to side, and eventually just open the clamp up, let it run back out, and they'll put a little flush in there to rinse it out a little bit and send you home. Send you home. So the main thing though, as far as takeaways when it comes to cancer, we do need to always understand that not all cancers have routine screenings. The ones that have screenings, please get screened. If you are of the appropriate age for screening, I do know that for some people having insurance or lack of insurance is a challenge, but there are ways to work around that. There are ways to work around that. And if anybody has any problems with that, between talking to Ms. Deborah or having her get in touch with me, I can work with you to make sure you get screened. If you are in a situation where you don't have money to get screened. Be aware of your health. If something changes, go get checked. If nothing else, please remember that. If something, I was in a presentation, there was a physician, she's a lung doctor, she said it's called, you got 5 senses. She said, you got a 6th sense. She called it SAR. Something ain't right. Something ain't right. Think about it. When you like, something ain't right. This ain't right. This doesn't feel normal. So the other thing is being honest with what is normal for your body, what is baseline for your body. And do not compare yourself to anybody else. You are uniquely and wonderfully made. You are you. But you need to know what's normal for yourself. And so when something ain't right, you'll know it. You'll know it and you'll go get help. Get somebody to check it out at least. So be aware of your health. Share your medical and family history. I talked about that early on, how as a people, especially black people, what grandma had, I don't know what grandma had. We didn't talk about that. Children did not sit in adult conversations. They didn't have those conversations that Pop called, oh, grandma had female problems. What does that mean? What does that mean? Or people say, well, you know, I'm 70 and I started having a cycle again. That's not good. That's not normal. Remember I said unless you are a female still in a menstrual cycle age, you should not ever start having bleeding again. Go get it checked. Something ain't right. We now have new therapies to treat and manage all of these diseases. And again, I'm so blessed that I've been around long enough that what we were offering people that had a cancer diagnosis back in 1986 when I first came out of nursing school versus what we're doing now, night and day. Night and day. Do we always do well with cancer? Absolutely not. I'm not going to sit up here and tell you that. But I will say that a lot of cancers that we used to tell people you got 6 months, these folks still looking at us 5, 6, 7 years later, still looking in your face. And they got stage 4 cancers and they still going. So it ain't over till God says it's over. And He has blessed us with all of this technology and hopefully this foreknowledge that when something ain't right, go get it checked. And make yourself a priority. Folks, we take care of the world. We take care of the grandbaby, we take care of the husband, the wife, pastor, we take care of the church. You get that when you wake up in the morning, you think about the church and what y'all got going on. Don't forget to take care of yourself. If you're not here, what are we going to do? We need you to take care of you. So make yourself a priority. Making yourself a priority is not a selfish thing. That is actually given to your folks, because when you take care of you, that means I can take care of all the other things that I have going on in my life. So make yourself a priority. That is very, very important, because we don't oftentimes do that. So throughout all of this, no matter what kind of cancer you hear me talk about or somebody else talk about, there's a balance to all of this stuff. There's a balance. You got to find your rhythm. You got to find your balance. The main thing is assertiveness. Don't let somebody tell you, oh, that's just normal. No, it's not normal. It is not normal for you to have blood from your rectum. That is not normal. It is not normal to tell somebody to tell you got hemorrhoids for a year, you've been bleeding for a year. That is not right. That is not right. Be assertive. No, I need you to keep checking. Pace yourself. Now, when I come, I was like, it's like, man, everybody in here got cancer, so pace yourself. No, pace yourself. And when you talk about all of these things that we want you to do, we want you to not smoke and not expose yourself to tobacco. We want you to eat healthy stuff. We want you to be active. But when I say be active, don't try to go out there and run 5 miles, but that's not going to happen for me. It may happen for you, but it would not be happening for me. Pace yourself. Set some realistic goals. Set some realistic goals. If you don't walk at all, my mama is 86 years old. God bless her, and I thank God for her. Still doing well, still taking care of herself. I, Mama, what you doing? I'm on the couch. Did you get off the couch today? Well, I said, Mama, did you go to the mailbox? So for my mom to get, she has steps. She has to go down steps. And then the mailbox is probably from here to that back door. That's a marathon for my mom. But that's a good activity for her. And on bad days, Mom, what you doing? Well, get up and walk from your bedroom to the end of the hall. Do that about 5 times. You know, we need to, again, set realistic goals. I think one time we had to talk, you talked about getting some Popeye's chicken. I like me some Popeye's chicken too. I ain't gonna tell you to stop going by Popeye's, but I'm just saying don't go by there every day. Don't go by there 3 times a day. If you're going 3 times a week to Popeye's, cut back to 2. Pace yourself. Set some realistic goals, because if I sit here and tell you you can't have no more Popeye's chicken, you're gonna be like, okay, Lord, that ain't gonna happen. So set some realistic goals. Yeah, it's great if you're drinking 8 glasses of water a day. But if you ain't drinking none and you start drinking 2, that's a victory. That's a victory. Set some realistic goals and pace yourself. And identify what strengthens your spirit. Now, this is something for me, especially in this day and age. We got so much stuff coming in, so much negativity, so much junk. We have to be careful what you allow folks to park at your door. Don't open the door for all that stuff. It's okay to say no. It's okay to stop watching the news. Every now and then you got to shut that stuff out, because if it's not strengthening your spirit, you need to spend that quiet time with the Lord instead of with the iPad or the TV. That will strengthen your spirit. Whatever it is that strengthens your spirit, if it's something that's burdening you down, if it's something that always keeps you depressed, if it's something that's always keeping you anxious, that's not feeding your spirit, that's not strengthening you, that's bearing you down. So we need to realistically look at the stuff that folks are bringing us and tell them, you know what, no, it's okay to say no. No, they start having certain conversations, you know what, I need to go. You don't have to hurt folks with that. If they're insistent, you might have to be a little forceful, but you say, I really don't want to have this conversation today. It's not helping me. It's okay to tell people that. It's okay that you don't want to hang out with certain folks anymore because of lifestyle or language or the things that they're bringing to the party. You don't have to do that. You don't have to do that. So identify what strengthens your spirit. Watch what you think. Thoughts generate our feelings and behaviors. If you're always thinking about God blessing Donald Trump, you're going to be in a headspace that is not good. If you're always thinking about this gerrymandering where they're redrawing the congressional district, if that's everything that's in your mind, you're not gonna be in a good place. Now, I will say, don't ignore it, make sure that you got something to do. We need to go vote. We need to make sure folks are registered to vote. We need to make sure people go out to vote when we get that opportunity. But watch your thoughts. Watch what you allow to stay in your head. And then the other thing, like, learn to laugh at yourself. You know, when you really think about it, we are the most hilarious. God has got to have a sense of humor. He just looked at us and like, man, it's just like a rat in a box. They keep hitting that same ball and it don't move. They keep butting their head up against this same wall. We just sit here and look at them, see when they're going to figure it out. Learn to laugh at yourself, because we butting heads about some stuff that we know ain't going to change. Some people that are not going to change. Some circumstances are not going to change. So what needs to change? How I see it, how I interact with it, how I let it come into my space, into my mind, into my heart. That's what needs to change. So learn to laugh at yourself and at life, because it is hilarious. The other thing I always leave with people is do small things with great love, because it will make all the difference in the world. Every little thing, and learning to appreciate the little things. There's no such thing as a little thing. The other thing that I'll share is that the one thing that I've learned, and my husband and I were talking about the other day, I've been doing cancer nursing so long that I've learned that we should not sweat the small stuff. And guess what? Most of the stuff we worry about is small stuff. When you deal with people that have had a cancer diagnosis, and I've done that my whole life, and then I go home and somebody's saying my shoes don't match, I'm like, okay. I didn't get that dress I want, okay. You're still alive, you can still eat. You have a house, you have a pillow to lay your head. So we need to be careful about that. So now, anybody have any questions? Because Mr. Board gave me a test to give y'all, so we're going to do some questions. We're going to do some questions. And I actually have some prizes. Yes, ma'am.
You mentioned that there's no diagnosis for the kidney cancer.
No screening.
No screening.
Mm-hmm.
But when you get it, what are the chances of being completely cured?
If they find it early, it's almost 95% chance of cure, almost 100% with kidney cancer if they find it early.
But
If not, it goes down from there, depending on the stage. It does not mean that it's not curable. With cancer, a lot of times for some we can offer a cure. A lot of times it's more about controlling it. You don't get necessarily get rid of it. It's still there, but you can control it and keep it from growing any further. So it really depends on the stage. And then all those other things, your age, your baseline health, all of those kind of things. If you got kidney cancer and the other kidney is in good shape, you're good. But if you got kidney cancer, the other kidney is bad too, because of high blood pressure, diabetes, and all of these things. That's a whole different picture. So there's a lot of things that come into play as far as not just getting diagnosed, but what is the background health situation about. That plays a lot with a lot of different kinds of cancers, because again, if you come in here with a bad heart, bad lung, bad kidney already, and then you get kidney cancer or any other kind of cancer, that changes the whole picture. Because you may have a cancer that's what we think is curable or controllable, but if all of that other stuff is messed up, then your recovery is not the same. So it is in everyone's best interest, whatever your particular issues are, whatever, be it high blood pressure, diabetes, gout, whatever. My particular thing is that, you know, and I don't necessarily talk about it, but I have a diagnosis of MS. Yeah, I have a diagnosis of MS. I didn't say I had MS. I have a diagnosis of MS, but MS doesn't have me. So, whatever your issue is, you manage it. And God will do the rest. He will do the rest. Any other questions?
How does kidney cancer, can kidney cancer affect you if you have to go on dialysis? How does that?
They would, if you have to go on dialysis, The cancer it doesn't matter about dialysis, you still got to treat it because the cancer will continue to spread and kill you. So you can still do dialysis. Dialysis don't even work with the kidneys anyway. Your kidneys are not functioning if you're on dialysis. And one of the things, and I did read that in my study, that patients that are on dialysis, that is an increased risk factor of developing kidney cancer. It's farther down the road. It's not something that happens that often. But it does not interfere with dialysis, but it does not help nor harm someone. That the only thing dialysis does is because you have to be dialyzed to filter all those medicines out. If you're getting some kind of drug therapy or drug treatment, you have to be careful about the dose, and you got to be careful about when you give it, because if you give me chemo and I go to dialysis, it's going to take it straight back out of my system. So I got to give my chemo after you get dialysis, so it'll stay in the system, because remember, dialysis is going to clean the blood just like the kidneys. So if I give my chemo before your dialysis and you go to dialysis, it's going to take every bit of it out. So it just adds another layer of what you have, because people on dialysis are getting chemo treatment, but you have to plan, and you're planning for when they get their drugs. Has to be, you have to work with the dialysis doctors to make sure it happens. Yes, ma'am.
You mentioned that sometimes the blood in the urine can be intermittent.
Yes.
Why is that? Is that an indicator of early stages, or is that just a characteristic?
It's just a characteristic. Usually it's early because it's just intermittent, and it's just there's a piece that's irritated in there, and every now and then it will kind of get more irritated. And usually if it's just skin, if it's just a little pinkish, but if it gets to be frank blood, that's something different. But usually that's an earlier sign if you just see it a little pink.
So once it's consistent, then you said that's later stage?
That's usually a later stage, when it gets consistently, when you pee out, you see it's blood. Or you see it and it looks like cocoa. That's the kind of thing that you would see. Any other questions? So a question for you all. What is the main function of a kidney? Filter the blood. It filters everything out of the blood. It filters it out. So what is one of the things, and I talk about it a lot, what is one of the things that increases your risk factor of getting kidney cancer and bladder cancer? Smoking. Smoking. The other things that we talked about was exposure to chemicals at work. Sometimes treatment for other cancers can do it, and all of those things can do it. So who has a higher rate of kidney cancer when you look at America? African Americans and Native Americans. You can read. African Americans and Native Americans. All right. I think we're good. Let me see, she got some more over here. What is the most common symptom of bladder cancer? Blood in the urine is the most common, and then flank, you said you start hurting back in your kidney area. My husband been listening to you talk, he said, what do you think it is? I'm hurting back here. I said, I don't know what it is, but you're going to the doctor. It's not kidney cancer, it's just most of them strains and strains. All right. Any questions? I'm just tickled that we almost finished on time. Almost finished on time. Ms. Board sent, last week you guys talked about skin cancer. And she gave me, and I really, when I found that thing, can black folks get skin cancer? I shared it with her. Yes, you can. Our melanoma is very protective of us, but you still can get it. So Mr. Board sent some wonderful skin samples here. Some of them are for skin sunscreen. It's a SPF 30 that you can put it on your face. You can do that, and then there's some stuff in here from itching relief. So please don't leave any of this. I told Mr. Board I'll make sure I gave it and that I put it out for you all, because you know she's gonna ask. as a pastor, when you see her, I don't know if she's gonna make it back for church Sunday, but the next time you see her, you tell Jimmy, put it out. Thank y'all so much. It's been great.
Thank you.
And we're good.
Thanks again, you have become a member of our church.
Look, my pastor, he always like, why you know the Bible study? Don't think you're gonna answer. But I'm gonna have to come back on Sunday for y'all with something.
All right. Thanks again for coming and giving us information. And then Brother Kincaid out there on the golf course the other day, and I started coughing, he couldn't stop. He said, "Oh yeah, you got something?" He said, "You got something?" We didn't know what it was. We know what it was. Oh. Yeah, I said, you usually read medical books, you have everything you read, right?
Yes, Lord.
But thanks again. Thanks for everyone for coming. Thank you. Still have some refreshments over here. And so we're praying again for this. Father, thank you for Sister Well. We just thank you for the insight and information she's shared. And I hope that, Father, we somewhere, some of us glean something that can help us along the way. And that we can pass it on to someone that we know, especially our families. And so we just thank you. Bless, Father, as we fellowship together. Bless the food. May it nourish our body. We thank you. In Jesus' name.